Okay, so today I wanted to talk to everyone about circumcision. I want you all to imagine going into the hospital, having your very first baby, going through the bonding and the skin to skin, and having your baby taken away for what is considered like the norm, procedures, making sure that everything's okay, checking with them. So they do this considerably through the first couple days. Well, in that time, if you decide to have a circumcision, they take your son away. They essentially strap him down to a table. They might apply a local anesthetic to numb the area before they start cutting into the skin. But all the while your child is away from you, away from family, scared. Newborns, I don't know if you know, they like to cuddle and be held and be in the same space, the type of shape that they were in when they were in the womb. It's comforting to be swaddled and taking things as they come, but what they're used to, if that makes sense. Circumcision's been around for, tens of thousands of years. It dates back to the Paleolithic era and Egyptian. It's on walls, and it's all over the area. As far as proof that it's been done, it's a common practice for like hygiene, but that's only if you're not accessible to clean water or you have extreme heat like in Africa. Also in Africa, there is an 80 to 100% chance that the male is circumcised, and that is only because it is a preventative measure for HIV transfer. And since it's so prevalent there, the studies that have been done there versus the studies that have been done here can't really be on any sort of equal level because they are just so different in cultures. Also, a lot of people in certain religions, Islam, Muslims, essentially Judaism, and Jews, they all practice circumcision out of a rite of passage, cleanliness. There's also the thought that if you circumcised a male penis, they would not want to have sex, which abstinence was a big thing they were pushing towards in certain religious sects. In America, though, there is a very high percentage of males that are circumcised. Now, that same percentage is not the amount of circumcisions based on religion, but they are a very high percentage compared to the low 30% of all males globally are circumcised. So you have to wonder, why are people getting circumcised? It's because the father is circumcised. It's because his father is circumcised. There are actually studies, the American Academy of Pediatrics said that there are studies showing that it's historical. If your dad is circumcised, then the son is going to be circumcised, and most likely his son, and so on and so forth. There are also Physicians for Genital Integrity organization. They are opposed to non-therapeutic and neonatal circumcision. These doctors span across all 50 states, Canada, some other international countries. And the Academy also published a report saying that circumcision protects against urinary tract infections, penile cancer, and various sexually transmitted diseases. It's a painful procedure for which the newborn should receive an analgesia. It's that word that gives them the opportunity to say, should we or shouldn't we? But it should always be used because pain, it's been shown also by the American Academy that pain is heightened. The sensitivity for pain is heightened in people people in newborns essentially that they have a heightened sensitivity to pain because of pain experienced as a newborn. They did a heel lance study where they would lance one of the child's heels and then test it years later, and they still showed a higher reaction to the pain. Existing scientific evidence demonstrates potential medical benefits. However, these data are not sufficient to recommend routine neonatal circumcisions. In the case of circumcision in which there are potential benefits and risks, it's not essential to the child's current well-being. The criticism to this was the fact that it said that. It said that it's not critical to the child's well-being. It wasn't necessary. It's basically saying there's not enough information to recommend you do one thing or the other, do what's best for your kid. Recommendations are more than enough reason to do it, but if it's not recommended, then is it really medically necessary? The studies done by the Journal of Prenatal Education to cover neonatal pain and the response to it, they showed that the equal pain tolerance was given once they applied an anesthetic to the area local. So they're saying essentially if you were to give every circumcision patient an anesthetic, it would not have the same response on their increased reaction to pain later. So essentially if they were to just give the anesthesia, the child would not have any adverse reaction. But to circumcise or not to circumcise, it seems like cleanliness and other factors in the United States aren't it. We have access to clean water, we can take showers, we can clean ourselves, and those are avoided. There's no significant risk to the newborn's health from not having the procedure, but if it's done the wrong way, it can be inverted, it can go back up into the body, there has to be surgeries to correct it, so there are all these negatives on why you shouldn't possibly cut off part of your son's penis, and there are also benefits in certain areas where HIV is dominant, and I understand it goes both ways, but the basics of a child being so young, not being able to give consent. What if they didn't want that part of their body cut off? It all comes into the American Academy of Pediatrics saying it's not essential to the child's well-being. That's all what it comes down to. The majority of people who are circumcised have no religious affiliation, so why are we doing it if it's not considered this rite of passage? There are literally no significant health risks for not circumcising your child, which is why the Pediatrics Association doesn't say that they need to do it. And the greater risk seems to be on the side of not, of having it done, actually, of doing the circumcision. So which way do you go when you are waffling on the decision? All they say, as far as the pediatricians, is to do your own research and make the decision based on what's best for your child. Cutting off a piece of skin or not, that's the choice.